For children, football players and fans across Asia, powered by football. And we're focusing especially in India today. But to tell you more, I'd like to invite our panelists. I'd like to start by inviting Grenville Hopkinson, the Social Franchising Director of One Goal, if you'd like to take your seat. We're very grateful to Magic Bus and the organizers of Next Steps for having us as part of this and allowing us to host this here. So I'd like to invite Prateek, CEO of Magic Bus, Mr. Prateek Kumar. We'd like to invite Pankaj Nemade, who's the Business Development Manager for Nutrition for Royal DSM. I'd like to invite Salil Kumar, who's the Manager of India Operations for GAIN. Invite Regina Manchfana, the Regional Director in Singapore for GAIN, representing One Goal. I'd like to invite Valentine Devada, the Group Director for Public Engagement for World Vision India. Most importantly, we'd like to invite two special guests of ours. I'd like to invite Mr. Baichung Bhutia, who's playing a nation proud, evidenced by his Arjuna Award and the Padma Shri. His strong opinions and isn't afraid to stand up for them. Today he's going to stand up for the children of this country. I'd also like to take this opportunity to invite our vice captain of our Indian team, a youth icon and a role model to emulate. I'd like to invite Mr. Ranveer Singh. I won't take up much of your time. Like I said, we are here to talk about a healthier Asia for football and its fans and all the children that it can potentially impact. And so to tell you more, I'd like to invite Grenville.
Good afternoon, good evening everybody. It's a pleasure to just welcome you to this launch of the One Goal campaign. One Goal is an initiative that was started with the AFC, Asian Football Confederation. As they were drafting their CSR strategy, they recognized that nutrition was a chronic issue across Asia and something that needed to be addressed if we were going to improve football for all in Asia. So, thank you. If you look at the research, health economists estimate that poor nutrition costs Asia about $100 billion a year. 4 to 8% GDP is lost through poor nutrition and its impact on children. So it's an underlying cause in, I think, 50% of child deaths. It also impairs child development. They drop out of school. Undernourished children drop out of school earlier. The World Bank has estimated that they lose 20% life earnings compared to well-nourished children. And also, it's linked to the onset of obesity, heart disease, and diabetes. So it costs the region an awful lot. So it's worth paying attention to. With the One Goal campaign, we aim to try to rectify that and even the playing fields here. Actually, there's a good news story with nutrition. The economic case for addressing nutrition is straightforward. If we increase the investment in this critical period of the first 1,000 days, we will save further down the line. You can see in the diagram here, if we just up that lever a little bit with the investment, we'll save all these incurred costs that nations face. So through the One Goal campaign, we aim to increase the awareness of this economic case. We want to talk about the first 1,000 days, which is a critical period when a child is conceived through the age of 2. And we know that if a child gets the right nutrients at that stage in life, their life pathway will be a lot better. So we want to get people talking about that, and we recognise that through football we've got this huge opportunity to talk to a new audience about this issue that actually health practitioners have known for the last couple of years. Next slide, please. We also aim to accelerate the scaling up of programs. So what we're aware of is that we all know what good practice programs are required to address nutrition. The Lancet report has been very clear on the range of interventions that should be supported, and even in the grassroots football area we know that there's great development models being used, and this conference that Pratik has been hosting really builds on that. We'd like to, we're structuring One Goal in a way that we can scale up these best practice project models so that other people can take them and respond to nutrition needs in their areas. Next slide, thank you. Finally, we really will see the longer term benefits of this campaign. The timeline for the campaign is in the run-up to the Qatar 2022 World Cup. So we have 10 years to try to make an impact on this issue, and we see that as we get early nutrition right, we'll be reducing the costs associated with sort of healthcare as in that later stage in life as people develop obesity or heart disease and other non-communicable diseases. So we'll be trying to target those issues. So how are we going to do that? One Goal is basically incorporates three elements. The first element is around advocacy and social mobilization. So this is where, because the campaign is endorsed by the AFC, we're getting access to some very high-profile sporting events, tournaments, major tournaments, and that creates an opportunity for mass messaging, advocacy and social mobilization. The second component is, as I said, scaling up effective programs. We want to look across all the partners that are involved in One Goal and find those best practice projects that we can scale up and roll out in different contexts. And the third element is really around financial sustainability. We believe that football gives us an opportunity to reach audiences in a new way, and even from the business model of One Goal, we're trying to set that up so that it's got an eye on sustainability. So we don't want to be reliant on handouts, we want to be generating a revenue that we can then allocate through projects. Next slide, thanks Pradeep. So just briefly, who's involved, why we've come together for this. We recognise that nutrition is a complex issue and no one agency or organisation has been able to tackle it so far. So we believe that in coming together as a consortium, we're creating a tipping point for change. We're building on the platform that the AFC are able to provide. We're building on the unique skills of the partners that you can see along the table. With World Vision, we've got this grassroots presence where we really can stimulate change and ignite a movement from the ground up. With the Asian Football Development Programme, they're focused on football as a tool for social development, social outreach through football. With DSM, the provider of vitamins and minerals, very much involved in the advocacy and the campaigning for better nutrition. They're a key part of the solution, and also with GAIN then as a technical advisor to the campaign, helping us with the development of really wide-scale interventions that are going to help us with nutrition. So that's briefly, sorry if I've just gone on a little bit too much, but I hope you get a picture of what we're setting out to achieve. Thanks. No, do that. Great.
Taking off from where Grenville left off, talking about the partners, I just want to give you a little description of each of the partners. We have got the Asian Football Confederation, which is the governing body of association football in Asia, with 47 member countries, mostly on the Asian continent, but that's just a little bit beyond the Asian countries. We've got the Asian Football Development Project, which was founded by His Royal Highness Prince Ali, the Vice President of FIFA. The idea is for Asia's football organizations to not only be innovative and but also be socially responsible in their development of football, also with a focus on the grassroots. We've got DSM. Royal DSM is a global science-based company which is active in health, nutrition, and materials. They connect unique competencies in life sciences and material sciences in driving economic prosperity, environmental progress, and social advances, creating sustainable value for all stakeholders. We've got GAIN, as Daniel said, the Global Alliance for Improved Nutrition, which is an alliance driven by the vision of a world without malnutrition. Created at a special session of the UN, GAIN supports public-private partnerships to increase access to the missing nutrients in diets necessary for people, communities, and economies to be stronger and healthier. And we've got World Vision, which is a Christian humanitarian organization dedicated to working with children, families, and their communities worldwide to reach their full potential by tackling the causes of poverty and justice. In India, World Vision is working to impact the lives of 24 lakh children and their families in over 5,300 communities, with a very special focus on the first 1,000 days from conception to the first 2 years of a child's life under the Child Health Now campaign. We also have on stage our ambassadors for the campaign, Mr. Bhaitram Bhutia and Mr. Renedy Singh. I'd like to call the partners to tell us why they're part of this campaign and why they believe they should be here and the impact that they can potentially make. So I'll start with a statement from Valentine Devada from World Vision India.
As World Vision, for us, this is such an important opportunity to partner with One Goal, because for us, we are a community-based organization. As Pradeep just said, we work with 24 lakh children, 5,300 communities, and for us the concern is that these children are the ones that are suffering, because malnutrition is one of the big concerns as we see in our nation. We find that almost 5,000 children die every day in India because of variable causes, and half of that is because of malnutrition. And we realize that unless we deal with the issue of malnutrition, we cannot really bring good health and ultimately bring well-being of our nation. We want to see our nation as a developed, a nation that is strong. And we realize that when we work with football is a way by which we can really mobilize community. We can deal with attitudes, we can deal with mindsets. And that is the way in which football can address this issue of malnutrition. And therefore we feel it's such a wonderful opportunity for World Vision to connect with the One Goal movement. And so we are very privileged to be part of this movement.
Invite Mr. Pankaj Nemre to speak on behalf of Royal DSM.
We are really proud to have this engagement with the AFC and GAIN, working with World Vision, GAIN and AFC. This gives us a platform to work with like-minded partners. At DSM, we are committed to bring innovative solutions at base of pyramid, also to address the child malnutrition. We work with various food partners through engagements, collaborations, and the innovative solutions to address the nutritional needs. Eradicating deficiencies and improving nutritional status, making people healthier and therefore better to contribute to their own development. We are fully convinced that improving public health is essential because we cannot succeed in a society which fails. This is what our CEO has given us a statement. And our mission is to create brighter lives for people today and generations to come. So we are really happy to be a partner of this event, and we'll do our best. Thank you.
Thank you, Pankaj. To speak on behalf of the Global Alliance for Improved Nutrition, I invite Mr. Salil Kumar.
Thank you very much. GAIN is also delighted to be a partner with the One Goal initiative. GAIN, or the Global Alliance for Improved Nutrition, is a relatively young organization, having been established in 2002 at the UN General Assembly Special Session on Children. Although young, GAIN's programs already extend to more than 30 countries worldwide, and are currently reaching close to 670 million individuals. In India, GAIN partners with a wide range of stakeholders, including government, multilateral agencies like UNICEF and the UN World Food Programme, research and academic institutions, NGOs, and also the private sector. Through these partnerships, GAIN's programs in India are already reaching over 100 million individuals, of which close to half are women and children. We recognize that the burden of malnutrition is extremely high in India, with nearly half the number of children below 6 years being undernourished, with an equal number of women being anemic. India has had considerable success in addressing different development challenges, especially in health. But malnutrition is multidimensional and hidden. Access, availability, and affordability to good quality nutritious foods in right quantities and at the right time to individuals, especially in the first 1,000 days, that is from pregnancy to the first 2 years of a child's life, is critical. Coupled with nutrition-sensitive interventions around agriculture, healthcare, hygiene, clean water and sanitation, all of these put together can go a long way in improving health and nutritional outcomes for our people to lead healthy and productive lives. GAIN partners with organizations to work directly with communities, creating awareness on appropriate maternal, infant, young child nutrition practices, including exclusive and continued breastfeeding, and also creating an enabling environment for effective and equitable delivery of quality public services through demand generation. GAIN strongly believes that empowered communities are the real agents of change. Many in India say that India today is a young country with more than half its population being in their prime productive years. And sports today in India is no longer considered a hobby, but has become a viable career and professional option for our youth. It is also becoming increasingly a lifestyle choice for many, and consequently addresses the problem of overnutrition and its attendant risks and complications. It is time for organizations like GAIN to seize the opportunity to broaden the scope of its traditional partnerships by engaging with multiple movements such as the One Goal Initiative. Football offers a unique avenue. It is all about passion, dedication, teamwork, and a will to win. This beautiful game is truly inclusive, bringing different peoples of all ages together. It is this passion, dedication, and teamwork that we at GAIN seek to bring to our fight against malnutrition. And we sincerely look forward to our association with the One Goal Initiative. Thank you.
Thank you. Ladies and gentlemen, these are the partners of One Goal Asia. But as we look at India and it being a very different context and very special and unique context, we really look to Magic Bus. In many ways, they've helped bring the two together, sport and development. And we just request Mr. Prateek Kumar, CEO of Magic Bus, to kind of unpack that a little for our audience. So, how are the two linked?
Thanks, Pradeep, and thank you, Grenville, for giving Magic Bus an opportunity to share this wonderful platform of One Goal. Yes, it is indeed a mystery, and I believe people who have not been associated with this space would kind of have this question on mind that what does football really have to do with nutrition? So, and to unpack this, I guess we could go into the Magic Bus way of the program delivery. So we're connecting two pieces here. One is a nutrition piece, which has been typically looked from the traditional angle as, either we have health systems or Anganwadis or families actually providing nutrition. So where does the play component fit in? And I'll try and address that issue. So what play and football in particular, even in the Magic Bus spaces, really does is that it allows us to use the power of play. And when I say the power of play, play itself, by the nature of how it is conducted in a Magic Bus setting, allows for mass participation. It allows for mass mobilization. It allows for fantastic youth engagement. It allows us to reach out to communities who are otherwise kind of confined, not open to discussions, not open to new learnings. But a game like football, which is kind of inherently popular, and I'm talking about certain sections of society, certain locations where there are other games which are popular as well. But football, in our own experiences in about the 14 states that we work in, speaks a universal language. You do have pockets where volleyball could be a little more popular. Cricket, of course, is very popular. But then you're also looking at a means where it is cost effective. You could actually think of a cricket approach to this problem as well. So mobilizing the community using cricket. But there's certain problems that we see in cricket, and because we've done it all, I can share it with you with confidence. We found it very difficult to engage women in cricket. We found it very difficult to engage a large number of people using cricket, because you typically have 4 or 5 people who are fully engaged in the game, and the rest of them kind of wait for their turns because of the nature of the game. And I love cricket, so it's not like I don't like it and hence I'm supporting football. But it's because of the approach which makes it cost effective, it makes it easy for us to deliver. And the other big thing is that if I have to get a girl into a program, and these are very important constituencies whenever you're doing interventions of this sort, and not just nutrition, in a lot of other spaces that we do, to get young girls to play some other games, it's a slightly difficult proposition. But a girl can still kick a ball. You need to still go to the paces so that she can develop the confidence to do so. But the chances that she'll be better at kicking a ball and not look extremely clumsy is very high in football. You can still manage to do it. And we've done it in very remote locations with girls who are in the adolescent age group, and young mothers and even grandmothers. So you'll be surprised that in communities that we've spent 4 or 5 years or 10 years, we have not only managed youth and children to be a part of our program, thanks to the power of play and football, but to get parents on the pitch and even grandparents on the pitch. And we've got grandmother teams competing in our Dharavi clubs. So there are these extreme examples which I'm not trying to suggest that this could be the norm that we're looking for. But the power of sport, that inherent power of sport, is something that we want to draw on. And that is the platform that we use to weave in nutrition messages, to come up with community leaders who will carry this nutrition program to the next level. Take it to the mothers, the parents, the grandparents who have kind of been living with centuries of inertia, following a traditional style of food intake, possibly out of ignorance or otherwise, and possibly adding on newer elements with the help of partners like GAIN and DSM and all, who know what it takes to take a child, whether it's 0 to 1000 or in the adolescent age group or tackling NCDs or obesity in the long run. There are techniques available, but the game of football will actually be the magnet, the engagement tool, the platform that will bring all these elements and stakeholders together. And we've been doing it very successfully across the country. So I think we could take it forward as well in this One Goal campaign.
Thank you. Thank you for that. The One Goal team has put together a report looking at nutrition across Asia, and Regina was part of the team that put that report together. To share a few insights from that report, right, Regina?
Yes, thank you. So we have actually produced a report that accompanies our One Goal campaign, and all the core partners, as you can see, they have undersigned the report. To shortly, I think you have to push further, it doesn't. Yes. To just highlight some of the core messages, as we have heard by the speakers, we would like to see actually nutrition as inclusive as football is. Football can be played everywhere, and we should also have nutrition be actually done in a way that it's highly efficient, and it should be inclusive. We also would like to generate and take the football passion, which I think we all have, and I'm sitting beside 2 very passionate footballers. We would like to create the same for nutrition. We want to have a nutrition passion, because what we want is we would like to actually see a movement. And the report underlines this and gives messages on how we can actually harness some of the football power and the football passion to translate this into nutrition. And also, the report underlines the need for investment in nutrition. And we have heard from the first speaker about the business case. We have heard how much money countries are losing when they don't address malnutrition. So we are demanding, we are posting, we are asking that we will have more investment in nutrition. But what we also want, of course, and this is why we are teaming up with the football, we want to see sports integrated in the lifestyle. We want to see sports, particularly football, being a real part in lifestyle activities. And ultimately, the report underlines the need that we have to position nutrition as a building block for development. When you look at the playing field right now, you will see there is a team with blue tricots and with yellows. And what we would like to do, we would like to level the playing field, because at the moment we see much more players that are actually hindering good nutrition. Much more players in the blue, they are actually causes for malnutrition. And what we would like to do is, we are asking for teaming up the yellow players, because those are some of the crucial interventions that we need to address malnutrition. And the report is underlying this message, and we are hoping that with the report we can actually create the understanding of what interventions we would need to have, what multi-sectoral partnerships we need. As we have heard, nutrition is not one problem, it's multi-sectoral. And definitely we would like build our one goal campaign on the passion of football, and hope we can translate it into a nutrition passion across Asia. Thank you.
Thank you, Regina. I'm going to ask our ambassador, who's not just a footballer par excellence, but also a father of young children, what he thinks of this report and why he'd want to be part of the One Goal campaign. Sebastian Bhutia.
I think nutrition is one of the major factors for any successful footballer. And sadly, I think just seeing the reports and just speaking and hearing from the people here, that India, we've got almost 5,000 deaths every day due to malnutrition, which is really, really sad. And for me, I think the campaign, One Goal campaign, is something I would want to support, because it's something to do with football. And I hope people working with this can reach out and educate, and also bring an awareness to the parents, mothers and the kids of malnutrition. In fact, now I own a football club, and I have a team in Sikkim which compromises of under 14 team. And there's one talented young kid, and obviously he's an orphan. So looking at his talent and looking at his size, I think I feel sorry for him. He's highly, highly talented, but when it comes to growth and looking at that age and looking at some of the players at the same age, is a mass difference between the build and the kind of strength he possesses at the age of 12, 13. So it's sad that we lose out a lot of players through malnutrition. Just not sports as well, not just sports person as well, but on the whole, I think it's sad that country like India, where we're growing so fast, we're supposed to be one of the biggest growing country economically wise, to have malnutrition issues in this century is, I think, very, very sad. And I hope that in future, through awareness program, that this is something which I think Future Vision and other partners who are here as partners here would bring up. And just not in, I think, India, it's also the campaign is all over Asia. And in India especially, I think it's important that sports person are not aware or not educated in terms of nutrition. And I hope malnutrition is one issue which just not people here, but I think the government also has to take it more seriously, and hope in future that the numbers are reduced, and in a few years' time that we hear that not a single death has happened through malnutrition, which would be, I think, the biggest achievement for India in years to come. Thank you very much, and it's a great honor to be supporting One Goal campaign for me. Thank you.
Thank you so much. To release the report, I request Regina to hand over the report to Mr. Bhutia. And if you could release the report.
बैठ जा भाई, 1 मिनट में खेल ही खत्म हो जाएगा। बैठ के ले ले भाई। जूम लगा के आओ ना.
Yes, sir.
This really means a lot to us, both from Vaishung and from Janvi. We have one more request is to mark the start of this partnership and to see where One Goal will go. We request you to autograph One Ball. We request all the partners to autograph this ball to mark today and with the date. Yes. Yeah, the ball said Brazil, but you know. They have their own. Thank you. Thank you. With this, we hope to really kick off in the right direction. We'll take questions now. If you'd like to identify yourself from the media you represent, and we'd like to ask the question too. The panelists will be available for one-on-one questions immediately after this, but if you have anything to ask the panel, okay. Thank you all for coming. Panelists will be available for questions after this, but if you could just come up to the stage after. Thank you so much for coming, and yes, good evening.
Yes, sir.
आ जाना ना
हो गया फोटो खींच ली.